know that Dupuytren's disease is common in Northern Europe. And we all know that Dupuytren's disease, although present, is far less common in the Mediterranean. But it turns out, of course, that there are very few studies from the Mediterranean. And the only one I could find was a study from 1988 by Quintana Guitan, with fairly high figures, really, from Spain. So the obvious question that presents itself is, what about Bosnia? Now, this may not be an obvious question to the audience, but it so happens that students in our university have to do a thesis as part of their studies. And I had a student who was from Bosnia, and he'd like to go home to Bosnia and study this subject, so he did. This was done early in the 70s, soon after the war, and things were a bit chaotic. So the best system we came up with was that he just stopped people in the street who looked as though they were over 50 years old and asked them to see their hands. He asked them their age, whether they were Serbian, Croat or Muslim, whether they'd had surgery for Dupuytren's disease, and whether they had diabetes mellitus. What he actually asked them was, do you have sugar? Whether they smoked tobacco, and whether they consumed alcohol. I mean, drank at all. I mean, a large part of the population is Muslim, so they don't drink, most of them. And then he looked at their hands and to see whether they had Dupuytren's disease. That was the main part of the study. A separate part of the study was in a diabetic clinic, where he looked at all the inpatients and a consecutive number of outpatients. But these figures are separate from the main study. The staging was done very simply. Stage 1 we called, when there was no contracture, was only palmar changes. Stage 2, when there was less than 90 degrees total contracture of the finger. And stage 3, when there was more than 90 degrees total contracture of the finger. Altogether, in the main study, he stopped 1,287 people in the street. And people were very forthcoming, apparently. They didn't at all mind being asked. Hardly anyone refused to take part in the study. 80 of them were under the age of 50, so we were left with 610 men and 597 women. And we found that 210 of the men and 94 of the women had Dupuytren's disease. But there were contractures only in 79 of the men and 17 of the women. These are the incidence or the prevalence figures. I won't go into this in detail, but it is more or less as one would expect, in that it rises with rising age. The percentages are surprisingly high. There's the fall from old age to very old age, there's a fall, but please note that the figures here are quite small. And the same pattern for women, also surprisingly high percentages of Dupuytren's contracture, and again this fall in prevalence between old age and very old age. And again, the figures are, the material is quite small, the number of patients or individuals examined were quite small. So altogether there were 131 men with stage 1, just palmar changes, and 77 women. The stage 2 and stage 3 numbers you can see there. But there were also 13 patients who had been operated for Dupuytren's contractures, and 3 who said they'd been operated, but when he looked at their hands, it wasn't possible to see any remains of Dupuytren at all. So impossible that they were operated for something else. And for the women, there were 7 altogether who said they'd been operated, but 2, it was difficult really to be sure that what they said was correct. The right hand and left hand, a few people have found that there is more Dupuytren in the right hand than in the left. And this was true for men in this study. An enormous amount, 4 times as many right hands were affected as left. The distribution of the fingers is more or less as one would expect. More index fingers than I would have expected. I mean, in my experience, index finger affection is very rare. But he found some. And But the main thing, but this was among men. Among women, there was no difference between the right hand and the left hand, as shown on this slide. Now, the population of Bosnia is mixed, as you all know, between Serbians, Croats, and Muslims. And just out of interest, we did a similar study from the north of Norway with the Sami people, the Lapps of the north of Norway, compared to the indigenous Norwegian population, and found that the prevalence was twice as high in Norwegians as it was among Sami people. This turned out to be the case also in these figures. Whether it's correct or not I'll come back to in the discussion. But as you can see, the prevalence was significantly lower among Muslim men than it was among Croats and Serbians. This was statistically significantly lower. This was not true for women. In women, there was no difference. So it may well be a spurious finding. Tobacco smoking, there was no increased prevalence. Drinking alcohol, there was no increased prevalence. Whether one lived in an urban or rural area made no difference. But diabetes mellitus did. Do you have sugar? If they answered yes, they had an odds ratio of 2.75 among men and 2.79 among women for Dupuytren's contracture, or Dupuytren's disease. These are the prevalence figures among diabetics over here, men over there, women over down here, and you can see the numbers are fairly small, but the numbers, the percentage with Dupuytren is enormous. And these are the figures from the diabetic clinic. I mean, these are proven diabetics. If you ask someone, do you have sugar, does it really mean that they are diabetic? These are proven diabetics, and the prevalence of Dupuytren was enormous, as you can see, in the 60s and 70s%. There are a lot of things wrong with this study. The sampling method is not the way it's supposed to be done. But then on the other hand, what other way would there be to do a thing like this in Bosnia? And even if it's not perfect, it's probably better than just anecdotal comments from colleagues who have worked there or been there, and say, oh no, we don't see much of that, or oh yes, there's lots of that. You know, I mean, this is better than that. So it's a small step forward. There's one thing also that doesn't come out in conferences like this, which is the enormous difference between prevalence and need of treatment. Because it comes out, among other things, Mark, the difference between men and women. The prevalence among women is somewhat lower than among men, but not very much lower, particularly about elderly people. I mean, in the 70s and 80s, it's about 60% or over 50% of the prevalence of men. But even so, the ratio of operation between women and men is 1 to 7 in Sweden, in an enormous study. So you can have this disease without actually needing any treatment for it. Another thing which points in the same direction is that we sent DASH forms, disability of the arm, shoulder, and hand forms, to patients on our waiting lists. And this gives a score from 0 to 100. 0 is perfect, 100 is terrible. And people waiting for operation for Dupuytren's disease scored about 10 or 12. Patients with CMC1 arthritis scored 35. Patients with the carpal tunnel syndrome scored 40. Patients with simple ganglion scored 5. So it's not something that makes it terrible. I mean, it's not a life-threatening disease. There's also a strangeness that is lower among the very old. We found that, Gudmundsson found that in Iceland, and Mikkelsen found it in Norway. Diabetes is well known that it's associated with Dupuytren's disease, and it may be part of the explanation why they die younger. Indications for surgery will vary, of course, if you live in a poor country with a poor health system. the threshold is higher than in our countries. These are the figures or the incidence curves for men, and I don't think one should attach too much attention to these age groups, because the figures, the numbers examined were very small. But it really is in line with other countries with a lot of Dupuytren prevalence, not operations, but prevalence. So our conclusion is that Dupuytren's disease is really quite common in Bosnia, but that few feel the need for treatment, either of economical reasons or because it's not so developed that they feel they need treatment. The prevalence is, as everywhere else, highly age-dependent, and it's strongly associated with diabetes mellitus. Thank you.